infant, and it always affects the fetal and placental growth, and it helps in the maternal well-being and maternal outcomes. And if the lady is not getting adequate amount of micronutrients, that can lead to low birth weight and other fetal complications. So how we can see what is the normal weight gain that you expect during pregnancy. So majority of your pregnancy weight is gained during the last 2 trimesters, as all of us are aware of that. And the expected weight gain during pregnancy is average weight gain is 400 gram per week, and a total weight gain expected is 10 to 12 kg by the end of the pregnancy. So do not consume any, when you consider a normal person, when you are getting pregnant in the first trimester itself, you have to consume the same calories as that of a non-pregnant woman, and it is also based on the activity level of the woman. Like if it is sedentary acting woman, she can consume 1900 calorie, and if it moderate acting woman, 2230, and heavy working according to that. Then in the second and third trimesters, she needs to consume 300 calories additional, and it is needed for it can be achieved with nutrient dense formulas, and it is always possible to how you can get the 300 calories is by consuming one. It is simply by consuming 1 banana, 1 egg, or 1 glass of milk. And other specific nutrients are also required during pregnancy, and that is depending on the age and activity of the person. Then what is the recommended weight gain during pregnancy? If it is an underweight lady, 13 to 18 kg is expected, and normal weight 11.5 to 16 kg, and overweight it is 7 to 11.5 kg, and in obese woman it is 5 to 9 kg. So energy requirement is necessary for depositing the fat that is used during lactation to meet the increased basal metabolic rate and development of placenta and maternal tissues, and growth of the fetus also. Then what is the importance of lactation? As all of us are aware, lactation is a nutritionally demanding situation for the mother and also for the baby. So all the infants are to be exclusively breastfed in the first 6 months of lactation period, and the milk production is affected by the frequency of sucking and maternal hydration and prolactin hormone. Actually, prolactin is a hormone which is produced from the pituitary gland of the brain, and it plays an important role in immunity also. So in this COVID situation, breastfeeding will also help the mother to keep the child safe. So because it is this feeding helps the baby in keeping safe. And when you consider the milk production, it depends on the maternal hydration also. Maternal hydration means the breast milk, volume of the breast milk is depending on the mother's fluid intake, and normally the milk production is 750 ml per day, and in that 87% of water is also utilized from the mother's body. So you need to consume more of water during lactation period. So what is the calorie requirement during lactation? So lactation is actually there is an increased demand, calorie demand during lactation, and it is actually, if you consider pregnancy and lactation requires more nutrients compared to pregnancy. And actually when you start feeding the baby, it will take almost 2 to 3 weeks to fully establish the feeding routine, and the lactation is actually depending on the secretion of some specific hormones such as prolactin and oxytocin, as I said earlier. And if you consider actually how much amount of calorie is required to produce 100 ml of milk is actually 85 calories. So if you have to have adequate amount of calories, you will produce more amount of milk. And when you consider the 100 ml of, what is the calorie calorie content of 100 ml of human milk, that is 70 kilocalorie per 100 ml, and lactating mother require to consume adequate calories with an additional liter of fluids. Like as I said earlier, all the lactating mothers needs to consume more water, almost equal to 3 liters, to produce adequate amount of milk. And when you consider human milk, it is formulated, actually it is formulated to meet the nutritional requirements of the baby. But if you consider the iron content of the breast milk, it is very low. But even if it is very low, it is well absorbed by the body of the infant. So iron supplements and all is not necessary during breastfeeding, for the breastfeeding babies. And what is the energy requirement in lactation period? Actually, when you consider the first 6 months, the average daily milk production is 750 ml. For that, the total energy required is 185 divided by 100 into 750. That is equal to 637 kilocalories. So during pregnancy, the body deposits a huge amount of fat. So it is almost equal to 2000 gram for the first 30 weeks. So it comes around 18,000 kilocalories. So the pregnancy fat deposited during pregnancy is utilized in the first 6 months or 180 days of lactation. That energy is utilized by the lactating mother during the first 6 months. So that calorie is equal to 18,000 divided by 180, that is equal to 100. So when you calculate the additional energy requirement during the first 6 months, it is 637 minus 100, that is approximately equal to 550 kilocalorie. And when you consider the second 6 months of lactation, similarly, the daily average milk production is 600 ml. So the calorie required is 85 divided by 100 into 600, that is equal to 510 kilocalories. And all the fat deposits are utilized in the first 6 months. So there is no fat deposits there to utilize during the last 6 months. So the mother has to depend on the food to get the additional calories of 520. It is 510 to 520. So how we can initiate breastfeeding in mothers? Breastfeeding should be started as early as possible after normal delivery and C-section. So in case of general anesthesia, the recovery time may take, and always keep the child along with the mother to promote proper breastfeeding. And colostrum is the milk that is secreted during the first 3 days of after delivery, and as all of us are aware, it is a yellow thick liquid containing all the antibodies and all the essential vitamins A, D, E, and K, and it has to be adequately fed to the child. And when you consider the milk production in a healthier mother, it is almost 500 to 800 ml of milk per day to feed the infant with the 500 calories. And breastfeeding, actually how it helps the mother is by it helps to lose the weight of 2.5 kg per week, and at same time the mother can feed the baby adequate amount of milk. So breastfeeding actually provides an adequate hydration and protect against infection, and provides a superior nutrition to the baby and promote a bonding between the mother and the baby. So what are the essential nutrients for immunity during pregnancy, lactation, and context of COVID-19? So immune system, actually, as pregnancy is a critical period, like it's a vulnerable time, we require a lot of nutrients, that is immunity boosting nutrients during the pregnancy period, which are protein, iron, calcium, vitamin A, B, C, D, E, and K, along with magnesium, minerals such as magnesium, zinc, selenium, copper, iodine, omega-3 fatty acid, and pre and probiotic foods are also necessary to get protection from the virus. So, and how this immune system is helping us is by balancing the harmony between the body, and optimum nutrition is helping to strengthen the immune system and promote the early recovery. And as I said earlier, vitamin A, B, C, D, and minerals such as zinc, copper, and selenium, iron, and phytonutrients and omega-3 fatty acids are known as the immune nutrients, which protect the body from this coronavirus. Not only coronavirus, all kind of viral and bacterial infections can be prevented by properly giving the immune supplements, immune nutrients. Then if you consider the nutrient level, all the above nutrients are essential for antibody production, all of which if it is taken inadequately, and it can lead to immune suppression in the body, and it can aggravate malnutrition too. So then you have to consider the protein requirement in pregnancy and lactation. During pregnancy, the extra protein is needed for the synthesis of the new maternal and fetal tissues. And as RDA of pregnancy of protein is 78 gram per day, and a person who is having gestational diabetes requires 10 gram additional. And protein is of particular importance in lactation because it is estimated to have 10 grams of protein is secreted in milk every day. And during the first 6 months of lactation, the lactating mother should get 74 grams of protein, whereas in the 6 to 12 months, it has to be 68 gram per day. How we can achieve this high protein requirement is by giving adequate amount of lean protein, meat, poultry, legumes, nuts, seeds, and fish. Low fat milk and dairy products can also be given to the patient. And it is very important that all the protein rich sources are also richest sources of some essential micronutrients such as iron, copper, zinc, and B vitamins. Then carbohydrates and fiber. The recommended allowance of carbohydrate is 175 to 265 grams per day. It acts as a fuel for the fetal brain development. And the carbohydrate is always, you have to select the carbohydrate from whole grain cereals and foods because it contains most of the phytochemicals, antioxidants, and fiber, which help your body to protect you, to build the placenta and also supply adequate energy to the growth of the baby. And refined carbohydrates has to be avoided from the lactating mother's diet because it is deficient in most of the nutrients. Then when you consider the fiber intake, the pregnant and lactating woman should take 25 to 30 grams of dietary fiber per day, and which includes both insoluble and soluble fiber. Insoluble fiber act as a laxative which can soften the stool and helps in proper defecation, because constipation is mostly seen as a problem in pregnancy and in lactation. And soluble fibers such as pectins, gums, and mucilages has to be taken, which helps to reduce the blood cholesterol level as well as for controlling the blood glucose levels. So soluble fiber sources are fruits, vegetables, beans, and all the grains such as oats, barley, etc. has to be taken in the daily diet of the pregnant and lactating woman. Then fat is essential during pregnancy because, as I said, fat is usually deposited during the 30 weeks of pregnancy to utilize energy during the lactation time. So fat has to be come from 25 to 35% of the fat should be covered. Total daily calories should be from fat sources. Then visible fat intake should be 30 gram per day. Visible fat means when you add extra oil or extra butter or extra amount of any kind of oils or fat into the food, that is known as visible fat. That means 30 gram of visible fat, it can be available, like that means 1 teaspoon of oil or fat will give 45 calorie and 5 grams of fat. Okay. Then in pregnancy, the importance of fatty acids are very important because fatty acids are the essential nutrients that support the brain and eye development of the child. The different types of fatty acids are saturated fatty acid, monounsaturated fatty acid, polyunsaturated fatty acid, and dietary cholesterol. But polyunsaturated fatty acids are of two types, omega-3 and omega-6 fatty acid. So it is essential to have PUFA in the diet for the healthy brain and eye development of the child. That means the ratio of 5:1 is usually preferred. And the sources of omega-6 fatty acids are vegetable oils, whereas sources of omega-3 fatty acids are fatty fishes, soybean oil, olive oil, walnuts, etc. Then the importance of protein during the pregnancy, as I said, it improves the growth of the fetus, development of the placenta, enlargement of the maternal tissues, increased maternal blood volume, formation of amniotic fluid, and it prepares the mother for better delivery and better lactation. Then growth and calcium is essential during for the bone development, and it also helps to decrease hypertension, preeclampsia, gestational hypertension in mothers. Then it also helps in maintaining the bone strength and muscle contraction, and also for essential for blood clotting. Then iron is essential for red blood cell formation. Maintaining an additional iron content will help to maintain the placental iron levels, and building the iron stores in the fetal liver and compensate the blood loss during the pregnancy. Iron requirement during lactation is 21 gram, whereas in pregnancy it is 35 gram. So what are the good sources of iron? As I, it is mentioned, it is already seen. It can be seen like sprouted pulses, all the dry fruits, green leafy vegetables, egg, meat, and all the lentils. All these are the richest sources, and at least 3 serving of iron-rich foods needs to be ensured during pregnancy, and minimum of 2 serving of iron-rich foods should be ensured during lactation. Calcium-rich foods include you have to maintain a calcium level of 1000 to 1200 milligram during pregnancy and lactation. All the calcium-rich foods and dairy products, milk products, cheese, and all the green leafy vegetables, and all the seafoods, broccoli, all these items are rich in calcium. So when you consider the recommended dietary allowance of the lactating and pregnant woman, actually it is actually what I have shown in the blue color is, it is a requirement during pregnancy, and no, sorry, it is the requirement COVID situation, when we require an immunocompromised state, when we require more immunity, we have to include these immune nutrients. And the other one which I have shown in pink is during the these are the prenatal nutrients that is essential during pregnancy. So it is very clear from the slide that vitamin A is required more in pregnancy and lactation. Folate is also required almost 500 micrograms in pregnancy and 300 micrograms in lactation. And when you consider vitamin C, it is almost 60 milligrams in pregnancy, 80 milligrams in lactation. Calcium is also double. The requirement is double during pregnancy and lactation. Iron is also double during pregnancy. And selenium and zinc are the important micro minerals which are essential for boosting the immunity, and the requirement is also high during pregnancy. So what is mean by immunity, and what are the immune nutrients? What is it? How it is possible to build up immunity using these nutrients? Actually, how these micronutrients act in our body is by natural defense mechanism of the skin and mucosa. It is through cellular immunity and by antibody production. So micronutrient deficiency actually suppresses the immunity by affecting the innate and T-cell mediated adaptive antibody response, leading to a dysregulation and balanced host response. And it also, this micronutrient deficiency can also cause infections, morbidity, and loss of an alteration in the metabolic pathway. And the essential vitamins required during pregnancy are B vitamin, B1, B2, B3, B6, and B9. So what is the role of B1 in pregnancy? B1 is known as thiamine, which is helping to relieve nausea of pregnancy and proper nerve signals. And B2 and B3 is essential for the total, as the requirement of total energy is very high. This vitamin B2 and B3 requirement also increases with that. Then B6 helps the body to make RBC and also helps to carry the oxygen through the body. And B9, like folic acid, it is very crucial for the production of DNA and RNA synthesis. And as all of us are aware, like deficiency of folic acid can cause megaloblastic anemia and spina bifida in young infants. Then B12, vitamin B12 is a essential vitamin which is required for the brain and nervous system development in fetus and fetal blood flow. When you consider the fetal blood flow, it is the vitamin B12 amount is twice as compared to the maternal blood, and low maternal levels are associated with prematurity and reduced RBC formation and reduced nervous system function. And vitamin B12 is essential for maintaining the gut microflora, thereby promoting the immunity. And when you consider the other water soluble vitamin, vitamin C, which helps to which is also helping to increase the iron from the uh, blood. So deficiency of vitamin C increases the chance of preterm delivery, and it is also associated with premature rupture of the fetal membrane and increasing the neonatal death. The vitamin C has to be given also for providing immunity. Then the other vitamins such as fat soluble vitamin, vitamin A, D, E, and K. Vitamin A is needed in small quantity to protect the fetus from the immune system and infections and death. Vitamin D is required for the formation of bones, and vitamin K is required for the normal coagulation of blood and to prevent the newborn infant from hemorrhage. So what are the role of immunity? What are the role of water soluble vitamins in immunity? As I said earlier, vitamin B6 helps in immunity regulation, cytotoxic activity. It reduces the inflammation and helps in amino acid synthesis and metabolism. So vitamin B6, pyridoxine, the richest sources are lentils, dals, moong, and green leafy vegetables. Vitamin B9 or folic acid also helps in better antibody production and metabolism. And the richest sources are lentils, fruits, nuts, seeds, etc. And vitamin B12 is essential to maintain the gut microbiota and T cell production and immunomodulator activity. The richest sources are found in animal foods only. So vegetarians are need to be supplemented with vitamin B12 as it is not present in vegetarian sources. But some amount is found in yeast and mushroom. Vitamin C stimulates the antibody formation and support the cellular function. It is present in green leafy vegetables, citrus fruits such as orange, lemon, etc., and papaya, strawberries, capsicum, and lemon, etc. So fat soluble vitamins and their role in immunity, as vitamin A is involved in the production, growth, and differentiation of red cells, lymph cells, and antibodies, and epithelial integrity. And it is present mainly in carrot, pumpkin, sweet potato, spinach, water squash, apricot, etc. And actually, there is no supplementation is necessary with vitamin A unless the woman is from an area where vitamin A deficiency predominates. Vitamin D, it has a protective role against bacterial viral infections, and it helps to reduce cytokines and maintain the gut integrity, gut microbiota, and enhances the calcium absorption. So how we should get vitamin D is by simply by exposure to sun between 11 a.m. to 1 p.m. for 15 minutes, and also can be available with fortified milk, eggs, and fish. A regular intake of vitamin E has benefits for our skin, hair, and eyesight and immunity. Vitamin K requirement is about 90 micrograms per day. So when you consider all these vitamins and minerals, uh, who is a person who requires supplements? Severely malnourished mothers and with those mothers with underweight and low milk volume. Vitamin D supplements to mothers who are not exposed to sun. Calcium supplements in case of inadequate intake. Vitamin B12 in case of vegetarians with malabsorption. Then this is a study where the extra choline provided to the pregnant woman decreases the negative effect of COVID-19 in their newborns. So it is essential to provide. This is a study published in Journal of Psychiatric Research, specifically looked at higher levels of choline levels can help to protect the fetus by developing the brain, even in mothers who are suffering from COVID-19 infection. Even though, so they have made a conclusion like blood plasma choline levels of 70 to 20 micromoles per liter will be adequate in mothers to get this positive result in newborns. Then the next is immunity and role of minerals. So zinc and selenium are the important minerals which helps to reduce the oxidative stress, altering the host response and viral infections. So the richest sources are whole grains, dals, pulses, seeds, and non-vegetarian foods such as chicken and egg, nuts items and seeds. And minerals such as magnesium play an important role in innate and acquired immunity. They can boost the immunoglobulins and can play a role in fighting against infections. So the richest sources are ragi, jowar, and pulses and legumes, and green leafy vegetables, almonds, all the nuts are the richest sources. So again, this is a study which in maternal multiple micronutrient supplementation and pregnancy outcome in developing countries, meta-analysis and meta-regression done where 11 randomized controlled trials were observed, and they have made a conclusion that adequate micronutrient supplementation improved the nutritional status as well as the hemoglobin status of the patients, and also it was helpful in maintaining the functional immunity of the patients. And the deficiencies of B complex vitamins as well as folic acid was prevalent in most of the cases, and that has resulted in homocystinemia. That homocystinemia is one of the important reasons that affecting the placental function. This was a study done in 2011. Some key nutrients for immunity other than micronutrients, some other key nutrients which help in immunity are pre and probiotics. Pre-probiotics help to reinforce the immune system, increasing the immune response and promote specific immune signaling by changing the gut microflora. So prebiotic category, it is also known as dietary fibers that stimulate the growth of gut microbiota, that is healthy microorganisms in the gut. Examples are garlic, onion, banana, barley, oats, apple, flax seeds, and wheat bran. And prebiotic and probiotic. The other one is probiotic. Probiotics are specific strains of live bacteria that is found in food. Examples are fermented milk, yogurt, fermented food products that can that can cause some impact on the gut microbiota, causing a positive impact on immunity. Then omega-3 fatty acids that can enhance the function of the immune cells, and the richest sources are all the non-vegetarian foods like fish, fatty fishes, nuts such as chia seed, walnuts, pumpkin seeds, sunflower seeds. As it is all mentioned in the it is all the pictures are shown in the slide, so it is very clear from the slide that all these foods are rich in omega-3 fatty acids. So goals of healthy eating is eat a variety of foods to get all the nutrients. So you have to make your recommended dietary allowance of at least 6 to 11 serving of cereal foods, 2 to 4 servings of fruit in your diet, 4 or more serving means 4 cups, at least maintain 4 cups of vegetables, and 1 serving of pulses and legumes. If you can consume it as sprouts or microgreens, that will enhance the nutritional quality of the food. Then 3 serving of protein rich foods such as meat, poultry, fish, egg. So 3 serving means 1 serving is 75 grams. A big piece of fish will give 75 grams. 30 grams of nuts daily. Liberal fluids, use fats and sweets sparingly. So the common problems related to food intake are during pregnancy. Most of the pregnant women may have morning sickness, diarrhea, constipation. Morning sickness can be relieved by eating crackers or some kind of crunchy kind of food items before getting out of the bed. Eat small amount of food and frequent meals during the day. Avoid fried and fatty items, spicy and greased foods. Constipation can be relieved by eating small amount of small frequent meals and drink a lot of water, like 6 to 8 glasses of water per day, and eat more of fresh fruits and vegetables. Then taste changes is usually seen in pregnancy. So some women may not tolerate the strong smell of the food. And some may be eating some kind of non-food items like laundry starch, dirt, clay, chalk, ashes, paint chips, etc. That is known as a condition called PICA, which is found along with anemia. Then WHO defines anemia as hemoglobin levels of less than 11 gram per DL or hematocrit values of less than 32%. And there are different grades of anemia: mild anemia, moderate, severe, and very severe. So common problems related to food intake is continuing. Then diarrhea, if there is diarrhea, eat more foods that containing pectin and gums because it is high in soluble fiber. Minimum of 10 grams of soluble fiber in the diet will help you to absorb more water and to relieve diarrhea. So examples of some soluble fiber rich foods are applesauce, bananas, white rice, oatmeal, barley, etc. So heartburn, it is a most commonly encountered problem during the second and third trimesters. So you have to eat small frequent meals throughout the day. Try drinking milk before eating and limit caffeinated foods and beverages, citric beverages and spicy foods. Then constipation is a common problem seen because of iron supplements. Maybe because of iron supplements to help relieve constipation, slowly increase the fiber content in a diet by including whole grain breads, whole grain food items, fruits and vegetables. Drinking at least 8 cups of fluid per day helps to maintain the fluid level, and moderate exercise will be helpful. So what are the foods to be avoided? Limit caffeine. Caffeine should not be more than 300 milligram per day. Even 1 cup of coffee will give you 150 milligrams of caffeine, and one full glass of caffeinated soda will give 30 to 60 grams of caffeine, milligrams of caffeine, and 1 cup of black tea will give 80 milligrams of caffeine. So be careful to limit the caffeine to less than 300 milligram per day. And dark chocolate is also having significant amount of caffeine, so you have to uh, avoid. It's better to avoid dark chocolates in the diet. So decrease the total amount of fat, and the advisable amount is 65 gram of fat per day, and limit cholesterol intake to less than 300 milligram per day. So other considerations during pregnancy: alcohol, drugs and smoking. Alcohol can cause growth retardation and fetal central nervous system damage. Drugs can cause prenatal weight gain or very short prolonged labor or operative delivery or prenatal outcomes. Smoking can cause impairment in the oxygen and nutrient transport through the placenta, and thereby reducing the blood flow. So you have to be very careful during pregnancy to avoid all these um, uh, unhealthy practices. So follow measures of food safety. This is a very important part. So as we are facing this COVID-19 situation, so you have to follow proper safety measures, such wash your hands properly while cooking, before eating. In between cooking, you have to wash your hands with soap solution.
Excuse me,
Minimum of
Jyoti ma'am, how many minutes more you will you
slides.
require? Yes, ma'am.
2 slides.
Okay, ma'am. Okay.
Okay. So the precautions, uh, follow the measures of food safety. You have to wash your hands 20 to 40 to 60 seconds to avoid infections, and precautions has to be taken while handling and preparing the food. Actually, when you If you want to wash the vegetables, you can keep it in vegetables and fruits in lukewarm water for half an hour by putting some amount of chlorine, and you can keep it for half an hour and can be used later. And otherwise, if you can use one portion of 1 cup of uh, um, what is that? Excuse me. You have to follow the proper personal hygiene practices, as the food is not a carrier. Like food will not carry the COVID-19 virus, but the infected person will be carrying the COVID-19 virus. So you have to follow proper personal hygiene practices to avoid the spread. So COVID-19 and breastfeeding, WHO recommends mothers with suspected or confirmed COVID-19 be encouraged to initiate or continue breastfeeding. If the mother is not able to directly breastfeed the baby, she can express the milk and can give it to the baby. So, and mother and infant should be enabled to remain together, but follow the proper hygienic and practices has to be followed. The general tips to face COVID-19 is limit the fat intake, limit the salt intake, limit the sugar intake, and high fiber diet is preferred with most of vegetables and fruits. Homemade foods are preferred. Avoid alcohol. Stay hydrated. Yoga, exercise, meditation, creative plays to reduce the stress are also important. So with this, I am winding up. So best wishes, best way to keep your baby healthy is to keep yourself healthy. So follow all these good practices and be safe and stay healthy. Thank you.
Thanks, madam, for such a valuable session. It enlightened all of us present here regarding the maternal nutrition. Next, we have a session on comprehensive nursing care in COVID-19, which will be taken care by Mrs. T.G. Thomas, MSN, RN, AHA Life Support Instructor, Medcare Women and Children Hospital, Dubai. In her 17 years of professional experience in the field of nursing, she played the role of nursing officer, charge nurse, clinical nurse educator, nursing supervisor, and so on. She is holding DHA and MOH license and published research articles in indexed journals. Moreover, she is friend of mine and colleague, and she was the jewel during our college days. I welcome you, ma'am, to lead the session.
Good afternoon, everyone. Can you all hear me?
Yes.
Yes, ma'am. Yes, ma'am.
Thank you, Ranjini, for the wonderful introduction. And now let me thank Father Ebi Vadakamdala, the Director, Pushpagiri Group of Institutions, and Sister Therese, the Principal, Pushpagiri College of Nursing, and Professor Ranjini Devi, HOD, OBG Department, and the organizing committee for giving me this opportunity. Let me share my screen. As you all know that this COVID-19 has created a very scary and uncertain situation in all our lives. Especially we nurses, initially when we know that there is a COVID-19 patient in our hospital, we were all very much afraid to take care of the patient. That is in the initial stages, but now the situation has been changed. We have proper guidelines, we have CDC guidelines, WHO guidelines, our national protocols. Each of us have our hospital protocols to how to take care of the COVID-19 patients. So we become more confident in the field of nursing to take care of the COVID-19 patients. But the fear among the general public is still continuing. So we know that especially the pregnant patient population, pregnancy itself is a stressful situation even in the normal time. So we can imagine how much stressful it is during this pandemic. As nurses, it is our responsibility to take care of our pregnant patient population through their journey of pregnancy. So more than our nursing care, they need psychological support and education and guidance. I think we are the best people to provide that. So in this session, we will see how we can take care of our pregnant patients during the antenatal, intranatal, and postnatal period. So as you all know that this COVID-19, it is a viral communicable disease. And in a pregnant woman, many physiological changes are happening in the woman's body. And screening a COVID positive pregnant woman is same like screening any other patient population. And the care depends upon the severity of symptoms. And the nursing care mainly focus on limiting the exposure and spread of virus. So the doctor was explaining the physiological changes which is happening in a pregnant woman's body, so that they are more prone to, they are immunocompromised, they are more prone to getting any kind of infection. COVID-19 is also one among that. There is nothing like they are more prone to COVID-19. They are prone to any kind of infection because they are immunocompromised. And also during pregnancy, there will be decreased lung functional residual capacity. So in case if a pregnant woman infected with COVID-19, there will be, because of this decreased lung functional residual capacity, they will find difficulty to clear the secretion. And also due to increased expression of ACO2, they may increase the chance of getting infection. But there is no evidence suggests that there is more chances of miscarriage due to getting infected with COVID-19, and there is no chance of vertical transmission, or there is no evidence suggests that it will affect the development of the baby. So the main risk factors for a pregnant woman to get COVID-19, usually elderly pregnancy, if the mother is more than 35 years of old, Black and Asians, obesity, and if the mother is having any comorbidities like hypertension, diabetes, asthma, and also cardiac problems. The mode of transmission, we are all very well familiar now. It can be spread through air, droplets, and contact precautions. The signs and symptoms, it is almost similar to for a pregnant woman, like any other non-pregnant people. There will be low grade of fever, headache, muscle ache, chills. Diarrhea will be little more in pregnant women than non-pregnant women. But the other symptoms like coughing, shortness of breath, loss of taste, smell, and sore throat, abdominal pain, nausea, vomiting, all these things will be same like any other non-pregnant women. And the laboratory values also, there are some studies shown that there will be, the laboratory values may conflict with the HELP syndrome. So the same symptoms like low hemolysis, elevated liver enzymes, and low platelet can be shown with the COVID positive pregnant women in the laboratory values. And there will be CRP, elevated CRP, leukocytosis, elevated neutrophil ratio in a pregnant woman. And if any pregnant woman come to our emergency or in the OPD with the fever alone, isolated fever without any symptom, still they have to go for a complete blood count check. Because if, and in case, if we find lymphopenia in the differential count, we have to direct them for a COVID screening. As you all know that it is a viral infection, it will affect the WBC count. So if there is lymphopenia with isolated fever, we have to direct the women for a COVID screening. Now we will move on to our nursing care during the antenatal period. So the care starts at, we all know that the pregnant patient care starts at home. So for us nurses, what we can do is that we have to educate the patients. The education should start during their first visit to the gynecological obstetrical OPD. So when they come to see the obstetrician in the OPD, it is the responsibility of the OPD nurse to educate them, give them support, and make them confident through their journey. So we have to educate them to maintain social distancing, hand hygiene, wearing a mask when they're going out, keep mobile and hydrated always, regular exercises, healthy diet, taking their supplementations like folic acid and vitamin D also is very important to prevent getting infections. And also we have to educate them to self-monitor themselves for any symptoms of COVID-19. We have to tell them, we have to explain them the symptoms, and they can self-monitor themselves at home. And in case needed, they can follow up a healthcare professional over the phone. As doctor was mentioning, telehealth is telemedicine. Many times because of the restrictions, traveling restrictions, it may not be possible for all the follow-ups for them to come to the hospital. So it is very much advisable if the mother is healthy, there is no other complications, no other comorbidities there. It is very much advisable to have alternate telehealth advisors. So what we have to do is that as nurses, when they come to the OPD, we have to give them a dedicated telephone number for them to contact us at any point of time. So if they develop any symptoms, even any maternal complications at any point of time, they can contact us at any time. Then if they develop any symptoms, we can direct them for the COVID screening. Now, if we follow, when they are coming to the face-to-face consultation, what we have to do is that we try to limit the face-to-face consultation less than 15 minutes. And also we have to inform them that there is only birth partner or a very healthy caregiver is, or a very healthy attender is allowed to accompany, nothing more than that. No children is allowed to accompany them. And also we have to minimize the time spent in the waiting area, so that what we have to do is that we have to space the two appointments, so that there will be more people, there won't be any much people in the waiting area. And also, as in case if we are following a telehealth follow-up, we nurses, we will be the one calling the patient, taking the complete history, and we will be directing to the doctor. So when we are calling the patient, along with the pregnancy-related conditions, how is the fetal movement, all the health, weight gain, when we are asking all these questions, these two questions are very important. We have to ask them whether they have any fever and any respiratory symptoms. If they have any fever or respiratory symptoms, we have to check whether it is mild, moderate, or severe. If it is mild or moderate symptoms, we can ask them to go for a COVID screening. Whereas if it is severe symptoms, we have to ask them to come to the hospital immediately for a complete assessment. The second question is that we have to ask them whether they have any contact with a suspected or confirmed COVID-19 case. If they have a contact, they don't need to be panicked. They don't need to rush to the hospital immediately. They can be at home. They can be self-quarantined and self-monitor themselves for any symptoms. If they develop any symptoms, they can contact their healthcare worker and we can give the advice accordingly. And this is a proposed antenatal schedule. The first and last visit has to be face-to-face. And in between, depends upon the obstetrician's advice, hospital protocols, and the health condition of the patient, we can schedule for telehealth appointments. And in case if a pregnant woman comes to the hospital for in the emergency or in the OPD for any kind of appointments, as per the CDC guidelines, they have to be screened for the symptoms of COVID-19. So when we screen, if we find any symptoms, then they have to be directed for a COVID screening. A PCR test has to be done. And also we have to do a complete clinical assessment that includes the airway, breathing, circulation, and also vaginal bleeding. Pulse oximetry is very important along with the vital signs, as it is affecting the COVID, is affecting the respiratory system. And also during pregnancy, there is the respiratory compromise. Pulse oximetry is very important to identify respiratory distress and hypoxia. Then chest ABG has to be done to identify the hypoxia, and chest X-ray and abdominal CT in unavoidable situations or patients with pregnant patients with the severe symptoms, it is advised with abdominal shielding. And also we have to check whether there is any shortness of breath, whether they are finding any difficulty to complete a sentence when they are talking, and also whether there is any cough with blood in the sputum, any new pain or pressure in the chest, any inability to swallow and to drink the liquids, any signs of dehydration, and any confusion or decreased responsiveness. If we identify any of these symptoms, the patient is a candidate for an immediate admission to the hospital. Now, if a patient gets admitted in the hospital, a pregnant woman with COVID positive admitted in the hospital rooms, it depends upon the severity of the symptoms. So patients with the mild and moderate symptoms can be in a single well-ventilated room, whereas the patient with the severe symptoms, with the severe coughing, and there is some aerosol generating, then they have to be in a negative pressure isolation room. Then for us nurses, for mild and moderate symptom patients, the frequency, we have to take care of ourselves, the exposure. So the frequency to go for the monitoring can be between 4 to 8 hours if the patient is with mild or moderate symptoms. So when we go to the patient room, we have to check the complete vital signs, fetal monitoring, and also the pulse oximetry. Then make sure that the doctor wrote a prophylactic low molecular weight heparin, as there will be coagulopathy during pregnancy, and also COVID can cause blood clots. Then antenatal corticosteroids, if doubt premature delivery, and also if there is a doubting premature delivery, and for the neuroprotection, if doctor advised to start with the magnesium infusion. We know that the magnesium itself, even in normal pregnancy, when we give magnesium, it can cause respiratory depression. So even this COVID positive patients, it will be more. So we have to be very careful. Patient should have a complete monitoring of the respiratory parameters if the patient is on magnesium infusion for the neuroprotection. Then admission to an intensive care unit. Who all are the candidates for an intensive care unit admission? If the patient is not, mainly due to the respiratory symptoms. If the patient is unable to maintain the oxygen saturation above 95%, even with supplemental oxygen, the patient is a candidate for an intensive care unit admission. So once the patient is in the intensive care unit, initially we will start, and also if the patient has any signs of hypotension, the mean arterial pressure is less than 65, and any evidence of end organ dysfunction like renal failure, patient is anuric or oliguric, patient is a candidate for an immediate admission to an intensive care unit. And in the intensive care unit, initially we will try with high flow oxygen, maximum non-rebreather mask with 50 liters of oxygen, or a Venturi mask, 60% oxygen. But still, if the patient is not maintaining and there is an altered level of mental status, the patient is a candidate for an immediate intubation. Once the patient is intubated, the ventilator care is same like any other non-pregnant patients. And for a pregnant woman, preferably we can provide a left lateral position to relieve pressure on the gravid uterus on venous return if it is not contraindicated. And also if there is a severe hypoxic respiratory failure, prone position, as you can see in the picture, prone position with supporting the gravid uterus is advised. The prone position can be provided for 6 to 12 hours. And also at the last stage, there will be ECMO, and please make sure that along with our WAP bundle, there should be anti-low molecular weight heparin is advised by the doctor. Now, in case if a pregnant woman arrested, if there is a cardiac arrest happened, what we will do? We nurses, we always have a tendency whenever there is a code blue announcement or cardiac arrest, immediately we will rush. We will not think about our health. We will just immediately rush to the scene. Here we have to be very careful. We have to have a proper PPE, the complete PPE, level 4 PPE we have to wear. Then only anybody is allowed to approach the patients. And as per the age protocols for a COVID positive patients CPR, the number of people has to be limited. It should be instead of 6, 3 to 4 people. So for a pregnant woman, in this 3 to 4 people, one obstetrician and one labor room nurse has to be included. And then the anesthetist and one more nurse can be included. Then for the cardiac compression, we have to post the compression during the intubation, advised rapid sequence intubation, because non-invasive ventilation like bag mask ventilation is not advised as it is aerosol generating. And also, as I said, minimize the number of people. And during intubation, if possible, a face shield has to be used for the patient to avoid the aerosols and also for the crash cart and other equipments, we have to limit the items taking inside the patient room. We can take the defibrillator alone, and the crash cart can be outside, and one person from outside can prepare the medicine and give to the people inside. Now we will see the treatment. As we all know that there is no specific treatment, only investigational antiviral therapies like remdesivir, hydroxychloroquine, lopinavir, and corticosteroids. Even hydrocortisone is advised at the early, and even infusions are giving. And also, it is better to avoid NSIDs. There are contradictory studies, as we all know that it is a new disease. Everyday studies are happening. So in some studies, it has proven that NSIDs can aggravate the symptoms. So better to avoid NSAIDs. Now, this is a patient case study, one of the hospitals here. A 39-year-old patient, gravida 4 and para 3, non-hypertensive and insulin-dependent diabetes mellitus on her 28 weeks. She presented in the emergency with fever and respiratory symptoms. On examination, it was identified that patient is hypoxic, not maintaining saturation on room air. So patient was shifted to ICU and started on oxygen supplementation, but gradually the patient's condition deteriorated and the patient was intubated and even tried with the prone positioning. And the patient was given antivirals, anticoagulation therapy. Then on the 15th day of intubation or hospitalization, the patient was taken for an emergency LSCS, and the baby was shifted to the NICU and the patient back to the ICU. And by 5th day of postoperative period, the patient started showing the improvements and gradually weaned off from the ventilator. And finally, she made a complete recovery from the virus after receiving the proper care in the ICU. Now we will see what are the precautions we have to take in the labor room when a patient is coming for the delivery. So as I said, the room, it depends upon the severity of the symptoms. If it is mild or moderate symptoms, patient can be in a single person room. Or if there is severe symptoms and aerosol generating procedures, patient has to be in a negative pressure room. Then when we get the information that a patient is coming, information has to go to the labor room in charge, obstetrician, neonatologist, and the infection control team. Then what we are doing here is that for all pregnant women by 38 weeks, we will send them for a PCR screening. So after that, at any time, and we will advise them to be at home, no going out after that. They should not expose with anybody else, especially with any suspected cases. And so that after that, at any time when they come to the hospital, they will be having a negative report. And also we have to minimize the number of people going inside the patient room. The persons, those who are going, should have a proper PPE. If there is no aerosol generating procedure, level 4 PPE is not needed. They can have face shield and 95 mask, gloves, and the isolation gown. Then if you are using an ultrasound machine in the patient room, it is better to have an isolated ultrasound machine until the patient's delivery. And in case if you are taking it out, it has to be properly cleaned. And for the maternal observation, along with the normal vital signs and CTG monitoring, always a pulse oximetry we have to monitor. And Endonox, it can be, there is no contraindication, it can be used, but better to avoid. And if it is using, there should be a single patient microbiological filter. Even oxygen mask also, it is not contraindicated. It is not an aerosol generating, but we know that the like patients, once they get pain and started more contractions, they will ask for oxygen, but only provide oxygen if it is unavoidable. Even though if it is not an aerosol generating, we know that patient will take it out in between and put it back. So there is more chances of transmitting the virus. So as much as possible, try to avoid. And delayed cord clamping, we are practicing delayed cord clamping even with the COVID positive patients with the proper PPEs, and baby can be cleaned and dried normally while the cord is still intact. And we have to make sure that the intake and output, there should be either a zero balance or negative fluid balance to avoid respiratory distress and respiratory complications. And the visitors, as I mentioned in the beginning, there should be only the birth partner or an immediate relative, that is a healthy relative. We are not preferring any aged people along with the patient. And also the birth partner, they have to produce a negative report if they are planning to accompany the patient inside the labor room or the operation theater for the delivery. They have to produce a negative COVID PCR report, not within 72 hours. And we have to, in case if a patient, sometimes we are getting unregistered patients without any proper antenatal history. So if any patient without a COVID test report, we will consider them as positive and treat accordingly. We have to take all the precautions. As much as possible, general anesthesia should be avoided for a cesarean delivery. As doctor was explaining, cesarean is not an indication, COVID positive is not an indication for a cesarean delivery. If it is clinically indicated, only can go for cesarean. Then general anesthesia, as much as possible, if there is cesarean, it should be avoided. And epidural, for the pain relief, epidural and spinal anesthesia is advised. There is no contraindication. And for the newborn care, So for all pregnant positive patients, once after delivery, the newborn is considered as suspected. So we have to go for a COVID screening. All the newborns, until the report is available, they will be considered as suspected. They have to be away from the healthy newborns. And also the mother can take care of the baby by wearing a mask and practicing hand hygiene. The baby can be with the mother with a distance of 6 feet distance. So as per the WHO recommendations, rooming is allowed, skin to skin contact is, and kangaroo mother care is allowed by using proper PPEs. That is what we are following in our hospital. All COVID positive mothers, we are allowing the baby to be with the mother with 6 feet distance and a healthy caregiver along with them. And we can only, it is contraindicated, or the mother and baby has to be separated. Either the mother is critically ill, needs an ICU admission, or the baby needs an NICU admission. In only this situation, we are separating the mother and baby. And also, the studies have proven that the consequences of keeping the mother and baby separately is more than keeping them together and getting the baby infected. Because as per the studies, even if the baby gets infected, the severity will be very less. And for us, luckily till now, we kept all the mothers, all the babies together with the mother in the same room, and breastfeeding, complete breastfeeding is advised by our lactation consultant. Until now, not even a single baby get infected. And we have to, as nurses and lactation consultants also can be involved. We are the best people to advise the mothers, because the mother will be very much concerned for feeding the baby, and mother has many concerns whether they can keep the baby inside the room, whether the baby will get infected. So we have to educate the mothers to practice respiratory hygiene during feeding, avoid coughing and sneezing while feeding, and consider wearing a mask. And in case if they cannot feed directly, they can use expressed milk. And for that, there should be a dedicated breast pump, and all hygienic protocols has to be followed. Once the breast milk is expressed, the baby has to be fed by a healthy caregiver.
Excuse me, ma'am. TG ma'am,
Yes.
how many minutes more you require, ma'am?
Few more slides. I will make it fast.
Okay, ma'am.
And routinely, we have to clean and disinfect the surfaces. And the postpartum management is same like any other non-COVID patients. The same management can be followed. And once the doctor identify that both mother and baby is healthy and fit for discharge, both mother and baby can be discharged. And for the postpartum follow-up also, we can consider both telehealth and face-to-face alternate. Initial one, if the mother is healthy, there is no other complications, the initial one can be telehealth. And by 6 weeks of postpartum, they have to come to the hospital for a complete assessment. Now, during pregnancy, we are very much concerned about the mental health of the patient. As I was explaining in the beginning, we nurses has more than the nursing care, they need psychological support. So during, because of this current situation, financial insecurities, unable to contact the support person, many mental health problems can occur during pregnancy. The symptoms are feeling sad and hopeless, negative thoughts about themselves, unable to sleep well even when the baby is sleeping, or sleeping too much, lack of interest or pleasure in doing things, and loss of appetite. So what we have to do, we have to educate them ahead to breathe and relax, keep them active at home by doing some exercises, then take the mind off by reading books and watch some funny movies, keep in touch with the friends and family, look after the health much more than before by eating well and drinking plenty of fluids, try and enjoy being pregnant. So we have to instruct them, and we have to educate the birth partner or the husband also to monitor the mother for any kind of symptoms. Now, if a pregnant healthcare worker is there in our institution, how we have to take care of them? There is no additional restriction for a healthcare worker, pregnant healthcare worker, to take care of a COVID positive patient. If they are healthy, they are, it is not, if their age is less than 35 and they don't have any other comorbidities, they are also allowed to take care of the COVID-19 patients. But if it is possible, and if we have enough staff, it is better to keep them away from the COVID positive cases. So the same thing we are also following here, that even in the emergency, we are giving them an option that if they, during their last trimester, if they wanted to be out from the emergency, we are giving them option to other non-COVID areas. So that is possible. And also what we are doing is that we are monitoring the temperature of all the staffs in a 12-hour shift. 3 times we will monitor the temperature of all the staffs. And if there is any symptoms and temperature above 37.6, they will be directed to the emergency. So to conclude, we nurses are the best person to take care of the pregnant women during their entire journey, during the antenatal, intranatal and postnatal period, to make a pleasant experience during the delivery, especially during the pregnancy, especially in this COVID season. Thank you.
Thank you, TG ma'am. It was indeed a very informative session. Next, we have the question answer session, question answer time. I invite Sister Serena to coordinate.
I think, Jinsi, you have already forwarded the questions to the concerned speakers, no?
Yes.
Yeah, could you please start with? Susan ma'am can answer the questions.
Can you just ask the question?
Ma'am, the first question is it possible for the virus to cross the placenta to the fetus?
In most of the cases, it's not possible because the vertical transmission is almost nil. But in 1 or 2 studies, they have told that in few cases, they have seen virus in the amniotic fluid, in the umbilical cord, but that is not consistent every time. So we think that there is no vertical transmission only because after the delivery, because of the contact and exposure, the baby is getting infected, even if it is getting infected.
Okay, ma'am. Next question, whether the baby is having any kind of effect of corona during pregnancy.
Till now, we don't have any evidence for the baby to getting affected with coronavirus infection. We have to wait because it's only a matter of 6 to 8 months now, no? So till now, we don't have any specific, because of the effect on the pregnancy, preterm, because of prematurity, that's all.
Among the 3 mentioned tests, which one is more reliable?
Definitely RT-PCR. Definitely RT-PCR. Only thing, it is taking time. That's the out of the lot, it is the best. That's also not foolproof.
What all measures should be taken to prevent the spread of COVID to the baby if the mother is positive?
Mother is positive, we have to take precautions. The best thing is to separate the mother when we consider spreading of the infection alone. Separate the baby, look after the baby somewhere else till the mother becomes negative. But that has got other psychological and effects on the baby, that for the growth of the baby, that maternal nearness is a must. So with all the careful precautions, all the like washing, cleaning the hands, using good mask, barrier, everything, you can allow rooming in, especially in low resource conditions. That is better. Angane oru study. That's the study we have.
Okay, ma'am. Next question is COVID-19 an indication for cesarean section?
Definitely not. For obstetric indication, we can do. And only thing, we have to avoid a prolonged labor where the patient is struggling a lot, so that mask won't be in position. All those things we have to, only that thing we have to keep in mind.
Does COVID-19 increase the risk of complication during pregnancy?
Actually, unlike other infection, it is not yet proved that increases the complications, but definitely PPROM is a little more than when we compare H1N1 or other respiratory influenza virus infection. The chance for the person to go in for ventilator, use of ventilator and ICU admission is less in COVID-19, comparatively less in COVID-19. But that is not the thing. We cannot take that as a chance to keep away from the precautions. We have to be careful to avoid infection, but comparatively not very scary.
Thank you, ma'am. That's all. Ma'am, over to TG, ma'am. TG, ma'am, you have a question. How to make a negative pressure room?
So the negative pressure rooms, the isolation rooms with negative pressure, so that the negative pressure that will be doing by the infection control, inside the room, the pressure will be negative, so that the infection, especially for the airborne infections, the virus will not go outside. The pressure will be, the inside of the room will be negative pressure, so that the pressure, the virus will be, even if we open the door, we can have a negative pressure inside, so the virus will be contained inside the room. So usually our rooms are positive pressure rooms. So what we are doing is that if there is an airborne contamination, then we are following a negative pressure room to contain the virus inside the room.
Okay, ma'am. That's all, ma'am. Thank you, Dr. Susan. Thank you, TG, ma'am, for your patient listening and for clearing all our queries. Thank you, Sister Serena. Here we are almost ready to end the session. I request all the delegates to view the chat box and click on the link provided for the feedback form. Please make sure that you fill the feedback form so that the e-certificate for your participation can be issued. Only if you fill the feedback form, you will be issued an e-certificate. Now I welcome Mrs. Alfonso Lissy Matthew, Assistant Professor, Department of Obstetrics and Gynecology, to express a word of gratitude.
Good afternoon all. With great pleasure, we the Department of OBG Nursing, Pushpagiri College of Nursing, Tiruvalla, would like to extend our sincere gratitude to each and everyone who helped us and supported us for conducting a webinar on COVID-19 pregnancy, childbirth and postnatal care. First of all, I would like to thank God Almighty for His blessings showered upon us. I extend our heartfelt thanks to our management for giving an opportunity to conduct a webinar. Special thanks to Dr. George Varghese, Principal, Pushpagiri College of Dental Sciences, for inaugurating the webinar and delivering the inaugural address. We extend our sincere thanks to Sister Therese SIC, Principal, Pushpagiri College of Nursing, Tiruvalla, for her constant support. Special gratitude to Professor Vinita Jacob, HOD, Department of Mental Health Nursing, Pushpagiri College of Nursing, for addressing the gathering. Thank you, ma'am, for your support. I would like to thank our distinguished speakers, Dr. Susan Matthew, Mrs. TG Thomas, and Dr. Jyoti S. Krishnan for making excellent presentations and making this webinar interesting and meaningful. Thank you all. A big thanks to Sister Serena CMC, HOD, Fundamentals of Nursing Department, for her support and guidance in coordinating the webinar. Special thanks to all faculty members, especially to Sister Mary Jyoti, HOD, Department of Child Health Nursing, for all the support and care. I must mention our deep sense of appreciation to Thomas sir and Mr. Marvin, and also to the team Medicity campus for their efforts and hard work towards the webinar. I appreciate the dedication of Professor Ranjini Devias, HOD, Department of OBG Nursing, and Mrs. Jinsi Mariam Yohanan for their coordinated efforts towards the success of the webinar. Also, I would like to appreciate 2016 batch students of Pushpagiri College of Nursing for their hard work towards the webinar, and also for releasing an informative video relating to breastfeeding. Finally, I would like to take this opportunity to place on record our hearty thanks to all the participants who actively attended the webinar. Once again, I thank each and everyone who took effort for the successful completion of our webinar on COVID-19 pregnancy, childbirth and postnatal care conducted by OBG Department of Pushpagiri College of Nursing, Tiruvalla. Thank you all.
Thank you so much, ma'am. Thank you one and all for your participation and for your keen listening throughout this webinar. Hope all of you have filled in the feedback form. Thank you once again. It's me, Jinsi Mariam Yohanan, signing off from the session. Thank you.